everybody. Welcome back to our Hilton House Insight Series. My name's Helen and this is Luke, and we're both from Hilton House Medical, and we've popped on here today to discuss a few topics that we found that are of interest, that are in the news recently, that relate a lot to your health, our health, and the health of everybody, really.
Yeah. Human health.
Human health, yes.
We're not a vet.
No. So you very kindly printed off some things for us to discuss, and I'm really intrigued about this one, which is the first topic of AI blood-taking robots.
Yes. So I was on LinkedIn the other day. Every morning I have my LinkedIn routine where, I don't know if you've seen, they do the LinkedIn games.
Yes.
So every morning, log in, do the LinkedIn games and just have a quick browse, because you can have a look at all the news stories, what's going on in your industry. So I see a lot of what's going on in the health world. And a video popped up of a blood-taking robot. Now, the robot is called Aletta by Vitestro, or Vitestro. I'll put some video of it on screen now.
Yeah.
So it is a fully automated phlebotomy robot that uses AI and imaging. You'll see what it can do, but basically it straps your arm into it, scans your skin, I think using infrared, looks for the veins, find the vein, does basically what the phlebotomist would do. But they claim, it's more accurate. There's no chance for human error in there. And on paper, I think it sounds really good.
It would be appealing to a lot of practices, out there.
Totally. I mean, you're freeing up a heck of a lot of time for your phlebotomist or any nurse, maybe, or a doctor that's doing that service in the practice. However, I'm not sure if they claim it in the video, but somewhere they talk about how blood taking is one of the top reasons for patient anxiety. Okay. Now, I'm not convinced that a robot is going to help put a patient at ease.
No.
Especially, go on.
I've seen that video clip.
Yeah.
I have seen it. And it's a really big machine, isn't it? Mm-hmm. It's quite intimidating.
Yeah.
And my mind goes to, different age range. If you've got a young child that needs to have that, if they're like you, they'll think it's really cool.
Yeah.
But some other children will be giving them nightmares, I should imagine.
Judging, now it's having you say that, judging by the look of the machine, I'm going to assume that there is some sort of 18 plus rating for it just because of the size of it. Yeah. I'm not sure you'd be able to put a child's arm in it and it'd work. So I thought we'd talk about this topic, firstly, because I am massively conflicted on it. I think the introduction of certain technologies into healthcare is a great thing and only benefits the patient. Things like that, they're using AI to sort of spot cancers.
Yeah, the screen tests, don't they?
Yeah, totally. Spot tumours and things on scans before a human could, just using, AI analysis of the whole healthcare system.
But you would think that would speed everything up, wouldn't it?
Yeah, but I don't know how widespread this sort of stuff is yet. AI is still kind of, I know we talk about it a lot, but it is still in its infancy and it's still not, completely in every single part of our lives just yet, but it is going that way. But the second reason I'm wanting to talk about it was because I'm really interested what you guys who are watching this think as potential patients. How would you feel if you went to the doctors and instead of having a human interaction, you were instead guided to a machine that is going to, take your blood? It straps you in, scans your arm, puts the needle in. Personally, I'd be terrified that it's going to go wrong.
I was going to say, I'd be exactly the same.
Yeah.
I would. I'd find it very imposing. I would be running through my mind how many things could go wrong. And also the fact that you've said a few times now, it straps you in. So anybody like me who's got, you're a little bit nervous about these kind of things, there's nowhere for you to go.
No.
You've got to stay in that seat.
Yeah.
And I find that quite intimidating.
Yeah. Now, they don't show any sort of safety measures. So you would assume that these guys kind of know what they're doing. And
Absolutely.
I see, you have to grab a handle. Maybe if you let go of the handle, the machine just stops what it's doing.
Yeah.
But it is still quite unsettling.
Yeah.
So yeah, we'd love you to comment. Let us know your thoughts on this, because we're curious about this.
Absolutely.
I'm super conflicted on whether I think it is a good thing or not. So especially if you are someone who's anxious having your bloods taken, how would you feel if it was, a robot doing it and not a human?
I think when you're going in for a blood test, you want to be put at ease.
Yeah.
And I don't see how a big imposing machine is going to put you at ease.
Yeah.
And a lot of people are fearful of needles. I'm personally not, but there are a lot of people out there who are. And I think what we do here that's great is we take that time to sit down with someone and put them at ease.
Yeah.
Make them a drink, etc. Make them feel comfortable in our environment.
Yeah.
And that also is a bit like a conveyor belt, isn't it?
Yeah. Again, in you go, and again, you'd hope someone's in the room with you while you're having it done by the machine.
Yeah.
You're not just being left alone with it.
And again, things can go wrong.
Yeah, absolutely.
Although it's not a human, it can still malfunction if it wants to.
Yes. We've got our phlebotomist here, Trish, who honestly, I think half the reason she's as good as she is because she really does put patients at ease. Personality is half the battle.
I agree. And she's also very calm.
Yeah.
Very calm.
Yep.
And she's very accurate with what she does. It doesn't faze her at all.
No, not at all. And again, every now and again, she might miss a vein. Every now and again, she might have to do another arm. It happens to every single phlebotomist.
Oh, and every doctor as well.
Yeah. There is always going to be an element of human error.
Exactly.
But would you rather have the human with the error, or do you want to completely get rid of any errors, theoretically, but completely lose the human touch?
And obviously with the human touch, you get that moment where you can take a breather.
Yeah, totally. If
here it almost feels like a roller coaster.
Yeah.
You're in and that's it. You've got to go to the end.
Absolutely. I feel like with the machine process of it, it shows that it's got a little screen on it and it's telling you what it's doing at each step of the way. But if you all of a sudden start to get a little bit nervous, the machine's not just going to take us, as far as I'm aware, isn't going to take a second to go, all right, let's just take a second.
Exactly.
Gather ourselves before we continue. Whereas a human can be so flexible in how it's doing things.
Yeah.
Another one, it looks as though you have to be sat there in the chair with your arm like this.
Yes. Is that comfortable for everybody?
No. And especially if we have patients who are prone to fainting, because again, this is one of the medical procedures, or I think it is the medical procedure that is the most likely to lead to someone fainting. We can have them lie down on a bed.
Yeah.
Have their arm out here, their arm here. If they're feeling lightheaded, we can switch positions. I'm not sure you can do that with this machine. We'll go through a few more of the points.
And then I guess we've got to think about, haven't we, that if you start with blood tests, what next?
Yeah, what's coming next? Yeah, absolutely. And we're going to be having like biopsy on your brain done. You just walk into a room, sit there, and it does your head, takes a bit, puts your cap back on, off you go. I don't know.
And all those other intimate examinations.
Yeah.
Do you really want a big opposing robot?
Yeah, absolutely. Yeah, and again, that's a tricky one for intimate examinations. A lot of people get very embarrassed, and I'm sure there are some people who would think, you know what, I'd rather just, have it all done by a machine and not have to have the human interaction. But if stuff goes wrong, even if it doesn't, it's the thought that something could. Are you ever going to be 100% confident that nothing is going to go wrong?
And heaven forbid you had a power cut midway through. Oh my word.
And just be stuck there. Get me out! Yeah, so again, I'd love for people just to let us know your thoughts on this. I find it really, really interesting. By all means, go and have a look. Once again, the robot is called Aletta, Aletta, by Vitestro, which is Vitestro. So have a look, see what you think, and let us know.
We'd love to hear from you.
Yeah, absolutely. I'll just go through the points here on the sheet just to make sure I haven't missed anything. But I think we've pretty much covered everything here. So, blood tests are one of the most common procedures in healthcare. There is a high demand for it, and due to staff shortages, you can understand why this might be a positive thing to start introducing this robot. Because automation could improve efficiency, consistency, and accuracy, theoretically. And I think that is probably true. It is probably going to be the case that if it's working 100% correctly, it's likely going to be more accurate and more consistent than a person. So that is the benefit. Phlebotomy, it's a big source of patient anxiety. You know, people who are scared of needles, people who are prone to fainting, either at the sight of blood, thought of what's going on.
Or they've had a bad experience in the past.
Previous bad experiences will 100% contribute to that. Does a robot make it better or worse? I've done a little side-by-side here of human versus robot.
Okay.
So for humans, like we've talked about, you get the reassurance, you get the communication, and again, you can be flexible when it comes to patient anxiety. You can change how you're going to approach taking the blood draw. With robots, it's all about precision, consistency, and no off days. You know, it's taken away the human element of doing the job. And there are pros and cons to the human element, but I think there's also serious pros and cons with a robot element. I think there's just one more point on the back. So the key takeaway, at the end of the day, it's not something that's going to be happening anytime soon. Again, due to cost mainly, it's a very expensive thing to have to do just one job. Whereas if you've got a nurse that can take bloods, but also, you know, perform some other well-being checks, doing height, weight, things like this, whatever the nurse in the practice might be doing, it's probably, you're getting more bang for your buck, if you will.
Yeah, I mean, it's like Trish that's here. She is our phlebotomist. So she is taking the bloods, and she has that. It's not just her specific role. She has other roles within the centre. But she is our phlebotomist. So she would, you know, we'll book her a block of blood tests, and she will do them one after the other. And I think that is a key asset to a practice. But also, you know, like computers and everything we use, it only takes for us something to break down on it, something to go wrong. And then I imagine it's an expensive bit of kit.
Definitely.
So to get a replacement is going to take some time. But this is all happening in the Netherlands at the moment, isn't it?
So that's where the machine's been developed. And the Netherlands seem to be really good at this sort of stuff. It's not the only the only sort of healthcare robot that they've developed, as far as I'm aware. There's quite a few coming out of there. But the main question would be to you guys: would you trust a robot to take your blood? I don't know.
So you don't know?
I don't know.
No, thank you from me.
Right. I need to have you put your sheet down.
Okay.
Because next, talking of blood tests, we are doing a blood test quiz.
Okay.
So we're going to find out how much you know about blood tests. We must say, Helen doesn't do blood tests. She's not a phlebotomist.
No.
We don't expect Helen to know everything about blood tests. I don't know everything about blood tests, but I have the answers in front of me, so I can pretend I do. So question 1 is, what is the most common reason that people faint during a blood test? Is it A, blood loss, B, pain, C, a sudden drop in heart rate and blood pressure, or D, low blood sugar?
I'm thinking about people suffering with anxiety, not liking the sight of blood, that kind of thing. So I'm going to go C.
Yes, a sudden drop in heart rate and blood
Excellent.
pressure, also known as the vasovagal response. It's basically your nervous system overreacting.
Yeah.
I will say all 4 of them can make you faint, but C is the most common.
Okay.
So, question 2. How much blood is typically taken in a standard blood test?
Okay.
Is it A, 1 to 2 millilitres, B, 5 to 10 millilitres, C, 50 millilitres, or D, 100 millilitres?
From what I do know about blood testing, it's not very much. So I'm going to go B.
B, well done, 5 to 10 millilitres. Yeah, it's a teeny tiny amount. It can feel like a lot more than that.
Yeah. Especially when it's coming out of your arm.
Yeah, absolutely. Yeah, totally. But the thing, I mean, the tubes, I think because the tubes are long, you see the height of the blood coming out and you think it's loads, but it's the very, very thin tubes. And usually there's also something else in that tube with the blood. That's why they have different blood tubes. You know, they might have a congealant or an anticoagulant or, you know, stuff like that in there. So they also take up some room in the tubes as well. Okay, question 3, we're halfway through.
How many questions are there?
4 questions, halfway through.
Okay.
Question 3, which colour bottle is most commonly used for routine blood tests like full blood count? Is it A, red, B, purple, C, blue, or D, green?
Now this one, this is going to be a pure guess. I'm going to say purple.
It is purple.
Oh!
It's purple.
And the only reason I said that is because it's my favourite colour.
Yes, purple.
My head was going, it's blue. It's blue. But no.
The purple top, it contains EDTA. It's done for all sorts of blood tests. It's a bit of a strange one because the gold top, which isn't mentioned here, is also...
gold top?
Yeah, there's a gold top or a yellow top. That one's used also loads. And I always think we've got way more of the gold tops in stock than we do the purples.
Okay.
So I don't know whether it's just the type of tests we do here. But yeah, purple is also used a lot. Red, I'll be honest, I've never come across a red top blood test. I'm pretty sure they do exist, but what they're for, I don't know. And yeah, blues and greens, we don't use a whole lot of, but purples, definitely, and then golds as well. Final question. How long does it usually take your body to replace the blood taken in a test? Is it A, a few hours, B, a day, C, a week, or D, 1 month?
Nah, A. A few hours.
It is, it's a few hours. Your body replaces plasma very quickly.
Yeah, because that's why, you know, coagulates in your, you know, it'll stop coming out of your skin, won't it?
Yeah, because
it will stop and coagulate and leave that little bit of a dark bump.
Yeah. Again, you're getting a tiny bit of blood taken.
Yeah, because you're told just to hold on a piece of cotton wool, aren't you? Just for a little while, and then it's
and
it's done within
if you're not
a couple of minutes.
If you're not prone to fainting or you don't mind having your blood taken, you don't feel any different afterwards. It's not like you come out feeling lightheaded. Yeah. It's a bit different if you're giving blood. Then you know you can feel it.
Yeah, of course.
But yeah, so that's the quiz.
Yeah, of course. I should imagine you need a big lie down if I was giving blood. After that, then you know, big sleep, recuperate, and then be ready the next day. I would have thought.
Yeah, it's great. They give you loads of biscuits.
Have you done it?
I've done it once. Every other time, unfortunately, I've not been eligible. But I've done it once, and they give you loads of biscuits. It's an interesting experience.
Sugar rush.
Yeah. I think just to keep you awake.
Yeah, I agree. Yeah.
Right, you can have your sheet back now because we are moving on to news of the week. Get it all ready. We need a little breakfast desk with laptops on here and special guests. So the first news story is Wegovy on the NHS. The weight loss injection Wegovy, so semaglutide, is set to be offered on the NHS.
So that's a new one, is it? Sorry.
Wegovy's been around for a while.
Okay.
So Wegovy, Mounjaro, Ozempic, they've all kind of been around at the same time. Just certain ones have been popular at different times and certain ones are popular in different areas. So I think in the UK at the minute, Mounjaro is
That's
the most popular
one I hear
one.
most.
But I think in America, Ozempic is still the most popular over there.
Okay.
I could be wrong on that, but I think that's how it is. So yeah, it's set to be offered on the NHS to over 1 million people in England. It is aimed at those who are overweight and have existing heart or circulation issues. So there's quite a lot of criteria that you have to meet in order to get it on the NHS. But it's being pushed as it's not just for weight loss, it's also about reducing heart attack and stroke risk.
That's interesting.
Yeah. So this was news to me, to be honest. So the recent trials show that there's around a 20% reduction in those risks when you're taking it. And interestingly, the benefits appear before any of the major weight loss.
Okay.
So they're sort of pushing that as the primary reason. It's not to do much with the weight loss, although, that's part of it, but it's more about heart attack and stroke risk and reducing that. For those who don't know, Wegovy, it's a weekly self-injection, and it'll be prescribed alongside existing meds, things like statins, which you'd imagine you'd already be on if you're high risk for these things, and also along a healthy diet and plenty of exercise as well. There are some reasons for that, especially for the exercise. One of the side effects is muscle loss. So you do have to keep up with your, exercise regimen. Making sure that you're not just wasting away, basically.
Because that's what we've done a bit of research, haven't we, ourselves, and we've noticed that people do, particularly in women, let's say they kind of lose their shape, don't they?
Yes.
And that, that's quite worrying for a woman,
Yeah, it is. It is. So the current limitations are it'll currently be capped at 2 years on the NHS.
Okay.
And again, there are some side effects. These can include nausea and bloating. It's not being, as I said, it's not really being positioned as a weight loss tool, more of a heart protection tool, I guess. That is the first news story. Okay, so our next news story of the week is about the aspirin shortage, which again, I didn't know about this, but there are reports of a nationwide aspirin shortage affecting UK pharmacies. Around 86% of pharmacies are saying that they've struggled to supply it.
That is a lot.
Yes. So why does it matter? For those who don't know, aspirin is a life-saving medication for people with heart disease.
Yeah, it thins the blood in the body.
Yeah, so it helps prevent heart attacks and strokes. I remember seeing a program ages ago that talked about aspirin helping with these things. I was very young. I think at the time I just thought it was like paracetamol. Some patients with stents and previous heart issues are struggling to get their regular supply. So this is quite a big issue for a lot of people.
It is a lot of people who rely on that.
Yeah.
If they've got heart disease, etc., then every day they're concerned. That they could have a heart attack.
Yeah,
and
absolutely.
So taking that gives them reassurance. So that to me is a really big, serious issue.
Yeah, quite scary. But as with our previous news story, if they start offering the Wegovy on the NHS to do with reducing stroke risk and heart attack risk, hopefully, if this happens again in the future, it shouldn't be as big of an issue if the same people are on Wegovy. Hopefully. Well, you don't know. So the reason for it is there are global supply chain issues and stock is being prioritised for the highest risk patients. So you do hope that those who are in desperate need of it are still getting it. But I am fairly confident there are going to be people affected by it who are also quite high risk.
But that concerns me, that highest risk patient. Surely everyone is a higher risk patient when it comes to that.
I guess they've got to prioritise it somehow.
Yeah, of course. Of course. Did it give you any indication on when this might be resolved?
No. There's no. There was no mention of what the future of this looks like. To be honest, you'd hope it only lasts maybe a couple of months.
Okay.
Yeah, we'll see. So yeah, if you do rely on aspirin, speak to your pharmacist.
Yeah, because they might be able to recommend an alternative.
Yeah,
maybe.
Some sort of alternative, or they can, if they don't have it, they can have a look around and see if anywhere else does have it as well. If you have to go elsewhere for it. Yeah, again, the takeaway being very common. Everyday medications can have shortages. It's not just, we saw when the weight loss drugs became a thing initially, there was a huge shortage. Again, with the recent meningitis B outbreak, there's then been a shortage of the meningitis B vaccine, which I think both of those, you almost think of them as more important medications than aspirin. Do you know what I mean? They're not. You think of them as higher levels than things like
like you've said. Stuff. You think that aspirin is like paracetamol.
Yeah,
you can get it just off the shelf in the supermarket.
Totally. But yeah, even these everyday medications can have shortages, and if we don't plan for them or see them coming, it can lead to problems for a lot of people, unfortunately. Then finally, speaking of meningitis B, there has been loads of news about it. You might have seen we put some videos out on our channel about it, just about the things to look for. If you haven't seen it, go and have a watch. But I just saw a story that I didn't want this to be fear-mongering for people, but it is still things just to bear in mind. So there was a case not too long ago of a young child who developed meningitis B despite being fully vaccinated. It's very rare, but the reason I'm bringing it up is just because you've had a vaccination for something doesn't mean to ignore serious symptoms.
Oh, no, absolutely.
Don't think to yourself, it couldn't possibly be. 99% chance it will be something else. It's not going to be what you've been vaccinated for, but just always, exercise caution with these sorts of things. But yeah, some important points: that the vaccine isn't 100% protective. That doesn't mean don't get it. Still get it. Yeah. But
we offer it at Hilton, don't we?
Yeah, we do. We offer the vaccination here. I believe we offer both doses. It's currently £195 off the top of my head. Yeah. But as with a lot of medications, the price is always subject to change. It just depends on how much we're having to get it supplied for.
Yeah, true.
But again, at the minute, stocks are low. So whenever we get an opportunity, we are ordering some in. But just bear in mind that there could be a slight delay if you try and get one. That's for anywhere, not just from us, but from anywhere. As I said, it significantly reduces severity, and the vaccine definitely saves lives. I'm not saying it's useless. It's a news story to, number one, talk about it, and number two, just, to make you aware of these things.
Of course. And with meningitis, there are different variants.
Yeah.
But the one we're talking about here is effectively the deadliest, isn't it?
Yeah.
It starts out maybe just with flu-like symptoms, but it can, as it says here, you can rapidly deteriorate.
Yes, it's a bit like sepsis, where things, like you say, deteriorate within hours, and you go from just feeling a little bit under the weather to barely being able to look at lights, high fever,
stiff neck,
headache. People are drowsy.
The rash.
The rash. So, but the rash is an interesting one. Everyone always brings up the rash. It doesn't always appear, and sometimes it appears way later on. So by the time someone's been admitted to hospital, that can then be when the rash comes up.
I think you quite rightly pointed that out, because I think I have a young child, and these kind of things always spook me when I hear this kind of thing in the news. Although this meningitis B can affect anybody at any age.
Yep.
But because I think, you might be looking out for all these symptoms. Have you got this? Oh, right, now it's time to go to hospital and check. But like you say, it doesn't appear straight away.
Yeah, I think there must have been, the way I'm assuming, I don't know, but I'm assuming that at some point when meningitis B was talked about and the health advice was given by, the NHS, your doctors, whoever, is that there will have been a period of time where they will have said, you need to look out for this rash. And with time and more research and looking into these symptoms, they've now realised that rash doesn't necessarily always apply.
No.
And so now they're doing a huge, if you look at any meningitis B advice nowadays, it'll always have the caveat of the rash is a symptom, but it doesn't always appear. Don't wait for that rash.
No.
The things like high fever, struggling to wake up, stiff neck, things like that.
Disorientation,
sensitivity to light.
Yes.
Those are far more common. It's just that they're not as easy to spot as a rash a lot of the time.
And the message from that really is always act fast.
Yes.
Because it's appears at first like with flu-like symptoms, you may think, well, go back to bed, have a bit of a sleep. You'll feel better when you wake up, but it progresses quickly, doesn't it?
Yeah, I think there's a large, we here at Hilton House Medical, we push a lot on preventative healthcare.
Yes.
And I think the reason we do that is there is a huge culture in the country of wait until you're really ill. Yes. A lot of people think, you don't want to just go and stress your doctors out for no reason. It's only something small. You don't want to take a trip to A&E when it's just a bit of a fever. The reason we talk about things like sepsis, like meningitis B, that can, progress rapidly is that you'd rather be safe than sorry. Get in there, get checked properly. You'll see a lot of our social media posts are about getting it checked early. Again, things like cancer.
Yes.
A lot of people will wait too long, and by that point you've massively reduced your chances of things going your way.
And I think a lot for all of us in this country, we come up against the age restrictions. You can't go from a women's point of view, you can't go for a mammogram until you're 50. Why is that? Why can't you go sooner? Surely if you went sooner, and there was a case actually this week at Manchester Hospital where a lady she basically received a letter about a medical trial and gone along to the Manchester Hospital, and it's a trial that's been set up. I don't know if you know who Sarah Harding is, who was a singer in the band.
Yes,
Girls Aloud.
Yeah.
So it's been set up in her name, this trial. And this lady from Manchester, who was in her early 30s, she went along and they did collect some cancerous cells. But because they were in their infancy, they treated her and she's now cancer-free. However, her consultant said that if she'd waited till she was 50 and received her letter to go for a mammogram, it's highly likely that she may have had a lump, she would have had to go for surgery, radiotherapy, chemotherapy, etc. And so I find that very interesting. I think, like you said, waiting to get that letter, waiting because we're told there's an age restriction on a lot of these things. I think that early detection and getting seen by somebody is far more vital to us all.
100%.
Than waiting, because sometimes we've seen it with patients where, unfortunately, by the time they've got to us, they may be at stage 4.
Things have been missed or taken too long.
Exactly.
Same thing with some parts of men's health as well. PSA testing, there is an age restriction on that. I'm not even sure what the current scheme is around PSA testing. I think there's been a change recently which might have made it even harder. I'll have a look at that. But yeah, things like that. You sent me a story the other day about a young lad who'd had his testicular cancer misdiagnosed somewhere in Gloucestershire. And again, by the time they figured out what it actually was, it was too late. But his initial diagnosis was just for an infection. They completely missed it.
Yeah, and it was also, he was younger. He was in his early 20s.
Yeah.
So I think we still have that barrier of, you're too young for this to happen to you. And I think that's why we exist. One of the many reasons why we exist is to give people that option to investigate sooner and get diagnosis quicker, and then a clear path on how to sort things out before it's too late.
Right.
Okay, well, I think that kind of wraps everything up for today.
Yeah, and we've gone through everything,
Okay, well, thanks for your time today, Luke.
Thank you very much.
And thanks for your time as well, and clicking on and listening to this. Obviously, we've got more topics coming up, but if there is anything you'd like to discuss, please pop it in the comments. And again, as Luke was saying before, we'd love to hear what you think about the AI robot taking your blood going forward. How would you feel about it? Are you comfortable about it? We'd be really interested, because we're a couple of geeks, aren't we? Really?
Well, it's just difficult to gauge what everyone else. We know what we think in the healthcare setting, but what do the patients think? We can quiz them on what we do, but when it's stuff like this that's outside of our clinic and it's just going on in the wider world, it's difficult to gauge. So we'd love to hear your feedback on that. Like, subscribe, and follow us for more updates, more interesting stories.
Exactly. And likewise, if you're sat there now and you're needing to see a doctor face to face, give Hilton House a call. We have availability for you. We have a free car park outside, easy to find us. So do get in touch. Don't hesitate. Okay. Lovely. Thanks a lot, Luke, and we'll see you again soon. Bye for now.
Bye.